Hey medicos, how you doing? Hope you are doing good. So I am back again with a new video. So in this particular video, we are going to discuss about mucormycosis, which is being a very hot topic nowadays. So I decided to make a video on this topic. So now mucormycosis is also known as the black fungi, although it has no connection with the black fungi, right? I know it could be a controversial statement from my side, but I am giving this statement very responsibly as I am a medical student. So let's see. Uh, so according to the microbiology, the mucormycosis have no significant uh, relation with the black fungi, right? It has no significant relation with the mucormycosis. The causative agent of mucormycosis is the Rhizopus, and if we talk about the black fungi, it causes the chromoblastomycosis, right? So the mucormycosis is not caused by the black fungi, right? Although the clinical manifestation of the mucormycosis is manifested as the black crust formation. That could be a reason that people call it as the black fungal disease. Now, moving forward to our topic, the mucormycosis was previously known by the name phycomycosis, then zygomycosis, and in the latest edition, you will find the mucormycosis as the latest name. So, mucormycosis, it is caused by the fungi which belong to the group Mucormycetes, which belong to the order Mucorales, which belong to the phylum Mucormycota. Right. So this fungi is a mold. So these fungi. So talking about the fungi, there are 9 members in the Mucormycetes, but out of these 9, the three are the lethal one, and out of these three, the Rhizopus being the lethalest one, causing about 90% of the cases, in the 90% of sorry in the 50% of the cases of the mucormycosis, Rhizopus found guilty, that is Rhizopus being the main culprit to cause the mucormycosis. This fungi is a mold. This fungi is a mold, and it exists in a two form, that is the spore form and the hyphal form. Hyphal form being the delicate form. So the mainly the spore form is the only form which enter in our body and causes the pathology. Right. If you talk about the mortality rate, and if you talk about like it is dangerous, so I will say yes, it is very very dangerous, because the mortality rate is about 50%, right? It is it is very high, and it can reach to up to 80% sometime according to the severity of the patient. So moving forward, so what are the habitats, what are the place where we can find this particular uh, fungi? So there are there are several places, but the three places which are favorite of this particular fungi, that is the moist soil, the animal dung, and the decaying organic matter, right? So these are the habitats where we can find this particular fungi. So let's see who are at risk. So the patient with the immunocompromised, the patient who are immunocompromised, as we can see the HIV patient. So the HIV patient are the immunocompromised, right? So not only they are susceptible to the fungal disease, they are also susceptible to other infections like the bacterial or the viral infection as well, because we know that in HIV the patient become immunocompromised. Talking about the diabetic patient, in the diabetes, the patient undergo hyperglycemic condition, right? So we know the if the patient undergone the hyperglycemic condition, that means the body is not allowing the glucose to enter into the body tissue. That is the reason to the glucose retain in the plasma. That's why your blood glucose level go high, and your macrophage and your immune cells are not are not getting the sufficient supply of glucose, and this will cause the macrophage dysfunction, the macrophage dysfunction, and which will lead to the impaired glutathione mechanism of the macrophage. Right, we know the macrophage have the glutathione mechanism, which through which it destroy the pathogen. So if that particular system or the mechanism impaired, the macrophage will not be able to fight with that fungi. The second reason being the ketoacidosis, right? We know that in the when the patient is the diabetic patient, the glucose is not entering the cells, so the body need energy now. So the body shift into the another mode that is called as the ketosis, and in ketosis the body start extracting the free fatty acid from the adipose tissue, and which causes the formation of ketone body. Now the excess amount of ketone body causes the ketoacidosis. Now the ketone body being one of the helper of this particular fungi, and also the rhizopus have it have a mechanism called as the ketone reductase mechanism, which through which it managed to grow, right? The second or another reason being the steroid use. Now in the as we know, nowadays the COVID patient are suffering with this particular situation. Most of the patient are taking steroid, right? Most of the patient are taking steroid, and they are taking steroid very aggressively, which will leading to the patient the which was the patient is having the hyperglycemic condition, due to the reason the body is becoming the insulin resistance, right? The steroid not only make the body insulin resistance, also it suppresses the immunity, right? So if the body is insulin resistant, so the same manifestation will be seen with the steroid user as we seen in the diabetic patient, because in this case also in the insulin resistance, the hyperglycemic condition will be increases, and due to the suppression in the immunity, this particular pathogen will manage to grow. The chemotherapy, the patient with the cancerous patient undergo the chemotherapy, and in this chemotherapy we give some substance to the patient, which not only destroyed the not only destroys the tumor cells, but also they manage to destroy some of the neutrophils as well. So the patient with the chemotherapy are seen with the condition called neutropenia, that is the decrease in the number of neutropenia. The last one being the iron overload. Now see, so, the iron is the main could be the main reason here, because this fungi take iron as a growth factor. The iron is the growth factor for this particular fungi. So the patient, when the patient is iron overload or the iron toxicity, we take iron chelators, right? So the if we take the iron chelator, for example, we have deferoxamine work as the it work as the mother for this particular fungi. It take the iron and it go and serve to the fungi, right? It work as the siderophore for the fungi. carrier. Siderophore is the carrier, carrier of iron, right? This chelator work as a siderophore, which work as the mother for this particular fungi, and which serves the iron to this particular fungi, and this fungi convert into the hyphal form from the spore form. Now this hyphal form will be growing in our body. But this particular particular pathology, that is the mucormycosis, is only seen with the patient which are immunocompromised, that we have learned from this particular slide. So let moving forward, let's see what are the route of transmission. So here we have three route of transmission of this particular pathogen, that is the Rhizopus. So there are three transmission route, like the ingestion, and the direct skin inoculation. So in the inhalation, the patient inhale the spore form of this fungi, right? So these are the route of transmission. Moving forward, let's see the pathogenesis, right? How it causes. For example, as you can see in this diagram, the patient inhaled the spore form of this fungi, and the spore form of that fungi gets stuck into the uh, respiratory mucosa. After depositing on the respiratory mucosa, due to the reason that the patient is immunocompromised, if the patient is immunosufficient, so this pathogen will not be able to grow, and the our immune system will eradicate this fungi out from our body, and we will not be suffering from the mucormycosis. But ultimately this is caused by the immunosuppression. So if the patient is immunocompromised, so this particular spore form will germinate into the hyphal form. It will, you can see it, it will germinate into the hyphal form, due to the reason we are taking the glucocorticoids, which are suppressing the immunity, and also the reason the patient is suffering from the neutropenia, that is decreased number in the uh, neutrophils. Now you can see the hyphal form is using the iron as the growth factor, and it is taking it as a growth factor and growing. The hyphal form will grow and make a you know and will start growing. So ultimately the hyphal form invade the vessels. As you can see, it is a angio-invasive, and ultimately if it manage to invade the vessels, so there will be the formation of thrombus, right? The thrombus will be formed, and we know that if there is some thrombus formation in the vessels, it will lead to the blockage of the vessel, which will ultimately block the supply of the blood to that particular area, causing the necrosis, right? That is the reason that it is clinically manifested as the black crust formation, due to the necrosis, and ultimately it will enter the circulation, causing the dissemination, that is the disseminated mucormycosis, which is the lethalest form of this disease. Now, moving forward, let's see what are the types of mucormycosis. See, the mucormycosis is subclassified according to the sites involved. So there are particularly six types of mucormycosis. Uh, that is the rhino-cerebral mucormycosis. The second one is the rhino-orbital-cerebral mucormycosis, pulmonary mucormycosis, cutaneous GIT mucormycosis, and the last one is the disseminated mucormycosis, which is the the dangerous one. So let's discuss one by one. So, rhinocerebral mucormycosis, as the name suggests, rhino means the nose, and the cerebral means the your brain is involved in this particular mucormycosis. As you can see, uh, as you can see in this patient, the nose is involved, and you can see the necrotizing tissue of the nose. Almost it has this fungi has eaten most of the nose, and ultimately it can reach to the cerebral also, right? So talking about the clinical manifestation of this particular disease, so if the in this particular rhinocerebral mucormycosis, the patient will be manifested as the nasal congestion, paranasal pain, and the black crust formation, and also there will be the discharge of black fluid from the nose as well. If the brain is involved, so if the brain is involved, the patient will be having the headache, vomiting, and also the seizures, right? So the other type of mucormycosis is the Rhino-orbital-Cerebral Mucormycosis. So, as the name suggests, in this particular mucormycosis, the three sites are involved. That is the rhino. Rhino means the nose. Orbito means your eye, which is you can see in this particular uh, image, and the cerebral means the brain. Right. So the clinical manifestation of this particular patient will be like the nasal congestion, paranasal pain, black crust formation, headache, vomiting, seizure. As you can see, the all the symptoms of the rhinocerebral mucormycosis. Additionally, due to the reason that the orbital is also involved, the patient will be having ptosis, that is the dropping of the eyelid, because the nerves are involved also in this particular disease. The nerves will be damaged, which will cause the ptosis, and the double vision, which is also known as the diplopia, along with the paraorbital cellulitis, which and ultimately the vision loss, right? So let's see in this particular images. So let's suppose your spore form enter through your nose through the inhalational route, and ultimately deposited here in the nasal cavity, and it start germinating into the hyphal form. Now the hyphal form is ready to to enter in all the paranasal sinuses, right? In all the paranasal sinuses. The paranasal sinuses are the sinuses which are in the periphery of the nasal cavity. So these are the maxillary sinus which can be involved. These are the ethmoid and the xiphoid, sorry, uh, sphenoid sinuses, and these are the frontal sinuses that could be involved, right? So we know that we have ethmoid bone here, and in the ethmoid bone we have the cerebriform plate, through where it can it can penetrate and enter into the uh, you know enter enter into this particular area, right? And also it can invade into the orbital cavity as well. So as you can see, if it enter into the orbital cavity, so you can see here the nerves and the muscles uh, which are aiding the eye for the movement, right, which hold the eye. So if the mucormycosis causative agent, that is the Rhizopus, manage to enter in that particular cavity, it will start destroying these muscles along with these nerve, causing the diplopia and the ptosis that I just tell you. And ultimately you can see, if the eye get involved, like the patient develop the orbital mucormycosis, and ultimately we have no, we have no uh, choice left, because we have to remove the eye, because if we don't remove the eye, the virus, sorry, the fungi will eventually enter the brain, because we know that the eye is connected with the optic nerve, and optic nerve is directly connected to the occipital lobe of the brain, and ultimately it can cause the brain damage, which could be more lethal than losing an eye. So as you can see, this is the olfactory bulb, which from which the olfactory nerve come down into the nasal cavity. So this olfactory nerve and olfactory bulb are also involved in this particular disease, and the patient may develop loss of smell, right? So that's how this particular virus, sorry, this particular fungi can enter in these cavity that I just show you. Moving forward toward other types of mucormycosis. So other type is the pulmonary mucormycosis, and the previous two, like the cerebro-orbital and these cerebro rhino-cerebro mucormycosis and the pulmonary mucormycosis, they have the same root, that is the inhalational route. And ultimately, talking about the pulmonary mucormycosis, ultimately the fungi manage to enter into the lungs, and you can see the necrotizing lesion in the lung of this patient, right? So the clinical manifestation with like the dyspnea, hemoptysis, and the chest pain. The the other type is the cutaneous mucormycosis. In the cutaneous mucormycosis, when the patient have any sort of cut on the body part, so the fungi get a room to to enter in your body. So the spore form of the rhizopus will get attached to that particular area that is having the cutaneous cut, and ultimately it will start germinating into the hyphal form, causing the cutaneous mucormycosis. And this particular as you can see, this is having the multifocus, and this particular type of cutaneous mucormycosis is called as the multifocal cutaneous mucormycosis. The clinical manifestation is like the papules, pustules, and the black crust formation in the cutaneous tissue. So next type is the gastrointestinal mucormycosis. This type of mucormycosis is not so common, because the patient uh, does uh, does not survive that long, that the patient may develop this particular type of mucormycosis, right? Maybe the patient get cured, or the patient die in between, right, most of the time. But some patient can develop gastrointestinal mucormycosis as well. The clinical manifestation, the patient will present with the non-specific abdominal pain, the nausea and vomiting, right, and with the fever and hemoptysis. As you can see in this particular colon, you can see the necrotizing lesions in this particular image, right? So moving forward into our last type, that is the disseminated mucormycosis. So this particular disseminated mucormycosis is the lethal one, and if the patient if the patient entered into this particular stage, this is the last stage, and 80% of the patient may die, because it is very lethal. Because in the disseminated mucormycosis, the fungi manage to enter into your circulation, that is the systemic circulation, and we know along with blood it can reach to the multi organ. As you can see, it can enter into the lungs, it can enter into the git, it can enter into your heart and brain and so on, like kidney and spleen, and so many organ can be damaged. And ultimately 80 to 90% of such patient with disseminated mucormycosis have to lose their life. It is an unfortunate thing, but it is true. So let's see about the prevention. As we know, the main culprit being the glucose level, high glucose level. So the patient have to maintain a healthy and a normal glucose level. For that, the patient have to check at least their vitals at least 3 times a day. So what what are those vitals? Like the vitals, like your your temperature, your heart rate, your respiratory rate, your SpO2, along with your glucose level. So the patient have also do the self examination. For example, we know that the clinical manifestation of this particular uh, disease is the black crust formation, as you have as we have already discussed in our previous slide. So so the patient have to do self examination, like is there any formation of black crust in the palate, or is there any secretion of black fluid from the nose. So the patient have to put an eye in these type of manifestations by their own. The patient have to avoid the unnecessary visit to doctor, because we know in this situation, in this pandemic, the viral load is very high in the hospitals, and due to the reason such patients are immunocompromised, so these patients should avoid the unnecessary visiting to doctors. So these patients are preferred, they are preferred to undergo the online consultation with the doctor, until and unless it is necessary to visit the doctor. So you have to you have to be very hygienic. You have to put an eye in any deposition, whether there is some fungal deposition in your house or not. You have to clean it. You don't have to make this fungus dominate your house, right? So you have to be very, very conscious about this particular disease. You have to eat healthy, and you have to eat, you don't have to eat from outside. You have to eat your own food, which is cooked in the house. And ultimately, the the main point being, don't do self medication. Now, I have to say something on this particular point. The main reason of the mucormycosis is the self-medication, because the patients are taking the steroid aggressively, dangerously, very high. For example, a doctor suggests to take only 6 mg of methyl prednisolone, but the patient get educated from the WhatsApp university, or from the YouTube university, and patient start doing self medication and double the dose of the steroid, and ultimately developing the hyperglycemic condition, which is the favorite thing for the growth of this particular fungi, right? So please avoid doing the self medication. There are doctors to prescribe you drugs, right? They know what is better and what is best for you, right? They have spent their life studying such kind of drugs, and all the things. So please avoid these. So talking about treatment, so about treatment, we will be making the separate video in the future, but I will give a brief uh, description about the treatment. Like the treatment like that, like we have the liposomal amphotericin B, which is the drug of choice for in this particular fungal disease. Along with, we use the posaconazole and the isavuconazole, which is also antifungal drug. And if there any surgical requirement, like the fungi manage to enter and spread in any of the cavity, and if it is required to do any surgery, so you have to undergo some surgical treatment. So that's all for today. So it was a detailed video on the mucormycosis, and we have discussed about lot of things, and we have also discussed like the mucormycosis is not caused by the black fungi, but due to the reason it is clinically manifested as the the black crust formation. So that's why the people called it as the black fungal disease. So that was the detailed explanation. So if you like this video, please hit the like button, and you can write in the comment box how you like the video. And if you want some more topic in future videos, please write me. And thank you for watching. Have a good day.